What is going on, everybody? Hey, today is Friday. Y'all already know what the deal is. You already know what the deal is. You already know what we about to do out here. So look. Today's Friday. I need for y'all to come with it today. Y'all already know we're going to be doing NCLEX questions today. So for everybody that's going to jump into this live, I want to know who you are, where you're from, where you're at in your nursing journey. You already know the deal. We need at least 100 folks. Hey, Heather, I ain't forget about you. You already know what we doing, though. So I got you. But shout out to all y'all that are jumping up in here. Y'all already know we're about to do NCLEX questions. I need 100 people to get up in this room. That takes about 5 minutes. So I want to know who y'all are, where y'all from, where y'all at in y'all nursing journey. We're going to be beginning doing some NCLEX questions. You already know what the deal is. I want to know. Heather, you know I got you. So what are we doing? Friday, y'all. It's Friday. Jason, my man, welcome. You already know what the deal is. You already know what you got to do. So, hey, I need for y'all to like, share, and follow. Smash that like button. Don't be greedy your whole life. You already know what the deal is. Make sure you guys share and make sure you guys follow me because I'm kind of cool. You're from Crystal Lake, Illinois. Isn't that like where Jason Voorhees is from? You know what I'm saying? Heather says, I'm here for some RN refresher education. Shout out to you, boo girl. You know what I'm saying? So I appreciate you. Crystal Lake. It's Camp Crystal Lake, right? That's what it is? Look, that shit's scary. You know what I'm saying? But how y'all doing? We got 12 folks up in here. Appreciate y'all. Hey, so we're going to be going over NCLEX questions. You already know the deal. We're going to go around, see what's going on. I'm waiting to get a good amount of folks up in here because then people are going to be like, oh my God, I missed the questions. So I want to know who y'all are, where you're from, where you're at in your nursing journey. Why you want to be a nurse? Why you want to do that? You know, let me know. Give me all the chisme. Give me all the tea. Let me know what's up. All right, cool. Eminem, hey, what's up, girl? How you? Hey, I need everybody in here to know that y'all are out here chasing greatness. You know what I'm saying? Hey, I know The Rock ain't made the best decision by trying to get people to donate the stuff, but, you know, we still out here chasing greatness, baby. That's what we doing. Shout out to all 30 plus of y'all up in here. Hey, we're going to be going over NCLEX questions soon. I need enough people in here for me to do it. So make sure you guys share, you guys like, and you guys follow. All three of those are the criteria to get this going, baby. That's what we doing. I dropped my course today and switched to traditional. Too fast for you? Was it too fast for you? Because, hey, those accelerated BSN programs they're a monster. But I'm so disappointed in myself. Why? Why are you disappointed? Why are you disappointed in yourself? Shout out to all 71 of y'all. You already know what the deal is. As soon as I hit 100, I'm turning this camera around so y'all ain't got to look at me no more. Make sure y'all share. Make sure y'all like. Make sure y'all follow. You already know what we finna do. Hey, baby, we at 100 right now. So you already know what we're about to do. We're about to turn it around. I think I'm stupid. Ma'am, you are not stupid. I can tell you why. Because you still here and you still fighting. Right? So that's what we do. We still fight around here. Hey, so check this out. Shout out to all 100 plus of y'all. You already know what we're about to do. We're about to do these NCLEX questions. Hey, so make sure you guys participate. Like, share, follow. Give me all them likes. I want them all. Don't troll my chat. If you've been here before, you troll my chat, I'm going to ban that ass. That's exactly what I'm going to do. I got these questions off nurselabs.com. I'm not gatekeeping. That's where I got them from. 7-day NCLEX course is my NCLEX course. It's in its pre-launch phase. You get it for $48. Right now, forever, for a lifetime, until it goes away. So link is in the bio. And if you want one-on-one coaching, you can book a call with me. You can check that out as well. Also, group coaching is coming. Just letting y'all know. All right, baby, here we go. So here is our first question. The nurse is aware that the following terms used to describe reduced cardiac output and perfusion impairment due to ineffective pumping of the heart is what? Anaphylactic shock, cardiogenic shock, distributive shock, or myocardial infarction. I need answers. Give them to me. Britt says B. Okay. Britt. Okay. All right. Is it niche? Nika? Whatever. Appreciate the follow. Thank you. Hey, make sure you guys like, share, follow, smash that like button. Give me all them likes. Give me all them follows. That's what helps, TikTok algorithm is algorithm. All right. Also, before I forget, my bad. All right, here we go. I'm going to give y'all 15 more seconds. I got to put a stop clock over here because I know some of y'all are just like, oh my God, take too long, man. All right, here we go. All right. It says, are we doing, I'm good at the same, what are we talking about? Cardio. It is cardio. It's whatever. It's a mix. So what's up, Brittany? How are you? Brody, what up? What up? All right, here we go. Here we go, y'all. Here we go. Here's our answer in 3, 2. And the answer is B, cardiogenic shock. Is shock related to ineffective pumping of the heart? All right. So there are 8 sections of the NCLEX pie. Really, Heather? 8 sections of the NCLEX pie are the client needs. Physiological adaptation is the 3rd largest section on the NCLEX. All right. So you guys just need, hey, be aware of that. Be aware of that. Okay. All right. So we have question number 2. Shout out to all 100 of y'all in here rocking with me. So a patient with hypertension asked the nurse which factors can cause blood pressure to drop to normal levels. Is it kidney excretion to sodium only, kidney retention of sodium and water, kidney excretion of sodium and water, or kidney retention of sodium and excretion of water? What are we thinking? What are we thinking? We got B's, we got some C's. Shout out to y'all. Make sure you guys smash that like button. Make sure you guys follow and make sure you guys share. Don't be greedy your whole life. I want to know who you are, where you're from, where you're at in your nursing journey. Are you a pre-nursing student? Are you a nursing student? You graduate already? You graduating soon? You taking that NCLEX? You've been a nurse for a while? Let me know. Heather, don't you say nothing. I already know too much about you. First semester nursing student, shout out to you. All right, I'm going to give you about 10 more seconds. 7 weeks left, baby. That's what I'm talking about. I'll take my NCLEX next week. Shout out to you, Miss Sanchez. RN, okay. All right, graduate in December. That's what I'm talking about. Look, if I could go to everybody's graduation, I would. Trust and believe me. I'd be your biggest fucking fan in the audience, let me tell you. All right, y'all, here we go. Here we go. Here's our answer. Here's our answer in 3, 2. Ooh, I hit the wrong one. Oops. Here we go. And the answer is C, kidneys excretion of water and sodium. The kidneys' response to rise in blood pressure by excreting sodium and excess water. This response ultimately affects systolic blood pressure by regulating blood volume. And that also is in physiological adaptations. Appreciate all the love and the follows from everybody. Appreciate you. You graduate in December. Hey, look, that's right around the corner. That's right around the corner. Shout out to all y'all for graduating. It's coming, baby. It's coming. All right, y'all. Here we go. On to the next one. So here we go. Question number 3. Nurse Rose is aware that the statement that best explains why furosemide, also known as Lasix, is administered to treat hypertension is it dilates peripheral blood vessels. It decreases sympathetic cardio acceleration. It inhibits the angiotensin converting enzymes, or it inhibits the reabsorption of sodium and water in the loop of Henle. Everybody's screaming D at me. Appreciate all 200 of y'all. Y'all keep y'all let me know. If you're new here, I want to know. I want to know who you are, where you are from, where you're at in your nursing journey. You know what I'm saying? I want to know all of it. Let's we'll foster a good conversation down here in the chat. We got D's. Who said oops? What's OP? OOP? That ain't even on there. Every time I happen to scroll past you, you're giving information on meds I take. Look, that's what I'm trying to tell you. That's what I'm trying to tell you. It ain't my fault. It's just the way the algorithm just, brings you to me. You know what I'm saying? I'm new, God willing. I pass in December. Hey, it's all, keep God in your life, but you got to think about it. You're the one that's doing it. Who said I'm a nurse educator? That's what I'm talking about. The Davy Jones experience, I'm guessing. Hey, I'm all about teaching. I love it. All right, y'all. Here we go. Here's our answer. In 3. I was a cardiac patient and have learned a lot through my journey. Look, you might as well just be a nurse now at this point. Is it Tater? Miss Tater? All right, here we go. And the answer is D. It inhibits the reabsorption of sodium and water in the loop of Henle. Furosemide is a loop diuretic that inhibits sodium and water reabsorption in the loop of Henle, thereby causing a decrease in blood pressure. So shout out to y'all. Appreciate it. Nurse, who's that? Nurse Ray? I'm going to say Ree. Thank you. Appreciate the follow. I appreciate the follow. Thank y'all. Hey, pharmacological and parenteral therapies, the second largest section on NCLEX. All right. Top 3, management of care, pharmacology, and physiological adaptation. Those be the ones, y'all. Those be the ones. Give me some hard ones. These are too easy. Hey, look, sorry. Blame nurseslabs.com. I can give you some hard ones, but I got to go searching for them. All right, here we go. Nurse Nikki knows the laboratory results support the diagnosis of lupus. Is what? Is it elevated serum complement levels? Is it thrombocytosis? Elevated sedimentation rate? Is it was it a pancreatopenia? Look, spelling bees are not my thing. If you got something to say, Sorry. Elevated anti-nuclear antibody titer or leukocytosis, elevated blood urea nitrogen, and creatinine levels. We got C's screaming at the C's. Appreciate y'all shattering that like button. Elevated A and A. Okay. C and A. Ma'am, you can only pick one. You can only pick one. I've had a positive A and A. Mm-hmm. Okay. Then, ma'am, Alyssa, you should know that answer then. Shout out to all 150 of y'all. Appreciate y'all being here. Make sure y'all smash that like button. Make sure y'all share. Make sure y'all follow. Don't be greedy your whole life. Spread the love. Knowledge is power, baby. That's how we do around here. All right, y'all. I'm going to give y'all 5 seconds. Jay, thank you for the follow. Appreciate it. Guest 20 says B or D. Lenny says or D. Ma'am, you got to let me know which one. Here we go. Here's our answer in 3, 2. And the answer is C, elevated ANA titer. Somebody just said that they had a positive ANA. Laboratory findings for clients with lupus usually show pancytopenia. Man, I say butchering that. An elevated ANA titer and decrease serum complement levels. I had a positive ANA. Wait to see rheumatologist. Did you end up having it? Are you talking about? Oh, I know you're not talking about me. Y'all like, ma'am, I don't got that. Oh, so you got that. Who's that? Evening Explorer. Okay. All right. They still don't know what's wrong with me though. They better figure it the fuck out. I'm just saying that all out of love. I don't know those people. All right, here we go. Question number 5. Arnold, a 19-year-old client with a mild concussion, is discharged from the emergency department. Before discharge, he complains of a headache. Now paint the picture. My man has a concussion. Now he's complaining of a headache, right? When offered acetaminophen, his mother tells the nurse the headache is severe and she would like her son to be on something stronger. Which of the following responses by the nurse is appropriate? Your son has a mild concussion. Acetaminophen is strong enough. Aspirin is avoided because of the dangers of Ray's syndrome in children or young adults. Narcotics are avoided after a head injury because they may hide a worsened condition. Or is it D? Stronger medications may lead to vomiting, which increase ICP. What are we thinking? Hey, if these are too easy for you, hey, I'm just letting you know. This is a refresher. This is how it works. For some people, they have no idea what this is. Hey, shout out to all my CNAs, my MAs, and most definitely my LPNs and my LVNs, right? I love y'all. I don't give a fuck what nobody say. Y'all are important. Y'all always be respected by me. And yeah, I love y'all. Answer these questions and follow me because I'm kind of cool sometimes. So, oh man. So we got C's. All right, I'm gonna give y'all 10 more seconds. 10 more seconds. Got D's. We got C's. Thank you for the LPNs. Hey, shout out to all my LPNs. Shout out to all y'all. Hey, I learned how to do wound care from LPNs. So I'm just saying, y'all are valuable. Y'all are, everybody in medical, y'all are valuable assets. All right, here we go, y'all. Here we go. Here's our answer in 3, 2. And the answer is C. Narcotics are avoided after a head injury because they may hide a worsening condition. Narcotics may mask changes in the level of consciousness that indicate increased ICP. I'm pre-med student, not even a nurse. Well, Tyra, what that got to do with nothing? What that don't got nothing to do with nothing? I got folks in here that are fucking med school students, that are PAs, that are, somebody was an electrical engineer and got like half of them right. I'm like, shout out to you. So it don't even matter. You don't know nothing? That's cool. I don't know nothing either. That's why I call myself the boot nurses, because I learn new things every day and I don't know everything. So, shout out to y'all. Software developer. Hey, I need a new website. Come holler at me. All right. Hey, health promotions and maintenance, y'all. Health promotions and maintenance. Hey, real quick. We're doing NCLEX questions. Participate. Give me them gifts. Don't troll my chat. You troll my chat, I'm a ban that ass. That's what it says, okay? So don't be rude. Nurselabs.com is where I got these questions. 7-day NCLEX course, which is my NCLEX course, $48 for a lifetime. And if you want coaching, go to my link in my bio. Holla at me. All right, here we go. Medical assistant working towards LPN. Shout out to you. Do you have LPN help? Yep, I help LPNs and I help RNs. Here we go. Question number 6. When evaluating an arterial blood gas from a male client with a subdural hematoma, the nurse notes the PaCO2 is 30. Which of the following best responses describes the result? Anticipate lower CO2 reduces intracranial pressure. Emergent, the client is poorly oxygenated. It's normal or significant. The client has an alveolar hypoventilation. What are we thinking? Got A's, we got some D's. Throw some D's on it. Maggie says A. Dee says D. Is it Hado? Hado says A. Okay. All right, what are we thinking, y'all? What are we thinking? Hey, if you guys are new here, welcome. We're doing NCLEX questions. I want to know who you are, where you're from, where you're at in your nursing journey. Don't be greedy. Make sure you guys like, share, and follow. Like, share, and follow. Don't be greedy your whole life. Hey, follow me, because sometimes people don't like me, and I like people that don't like me. Because you like to troll me, I'm going to troll you. It's what I like to do. Your RT says A. Shout out to all my RTs out there, and my PTs, and my PAs. You know, you're undecided? Well, you better get decided. I'm just saying, you better pick one. All right, y'all, here we go. Here's our answer. Here is our answer in 3, 2. And the answer is A, anticipated. Lowering CO2 reduces ICP. A normal CO2 value, or PA CO2 value, is 35 to 45. CO2 has vasodilating properties. Therefore, lowering PA CO2 through hyperventilation will lower ICP caused by dilated cerebral vessels. Oh, man, I got that one wrong. Oh, man, that's okay, though. That's okay, because this is why we learn. We come to these things, we learn, we understand. You read your rationales. That's one of the most important things of how you retain information. You read your rationales to why it's correct, and then also understand why these are incorrect, because you'd be so surprised on how you'd find that same question five questions down the line, but it's written differently. You'd be like, oh, I just got that, right? So here we go. Question number 7. When prioritizing care, which of the following clients should the nurse assess first? So this sounds like a management of care question to me, right? Management of care, largest section on NCLEX. Well, we have a 17-year-old, 24 hours post-appendectomy, a 33-year-old with recent diagnosis of Guillain-Barré syndrome, a 50-year-old with 3-day post-myocardial infarction, or a 50-year-old with diverticulitis. In med school, I don't know this shit. Y'all geniuses, stop it. Hey, y'all, we all got to start somewhere. I can guarantee you when I first started nursing school, I didn't know nothing about nothing. And then, you know, hey, here I am, still not knowing nothing. But I know a little something sometimes. All right, 15 seconds, y'all. So we got A's, we got some B's, we got some C's, okay? Aaron says C, all right. Okay, acute before chronic. Yes, acute before chronic. What is a keyword? Recent. Camille, ma'am. I knew you was going to be up in here. Website, what it says? So I'm a software engineer and maintain the hospital's website and random medical knowledge I pick up. Look, pick up enough. Hey, call yourself an honorary nurse. Just don't be out there trying to be a fake nurse, because, you know, we don't do that out here. You know what I'm saying? You can't, hey, you got to give me one. You got to give me one. All right, here we go, y'all. Here we go. Here's our answer. Here's our answer in 3, 2. And the answer is B, a 33-year-old client with recent diagnosis of Guillain-Barré syndrome. That's characterized by ascending paralysis and potential respiratory failure. So that's an airway breathing issue. The order of client assessment should follow client priorities with disorder of airway breathing and then circulation. Everybody stable. Who's stable? Is everybody stable? Nope, can't handle injuries. I prefer learning in secondhand. Okay, that's fair. That's fair. Lucas, who said that? I love your stuff. Hey, man, I appreciate it, man. I appreciate you being here. All right, hey, management of care, just like I said, the largest section on the NCLEX. Okay, largest section. Make sure you guys like, share, follow. Don't be greedy. All right, here we go. Here we go. Here we go. Guillain-Barré leads to potential. There you go. There you go, Erica. Shout out to you. You scared? Nicole, what you scared of? You just got here. And if you scared, go to church. You know what I'm saying? Or whatever higher, you know, structure beings that you follow. You know, whatever you want to do. This is Guillain-Barré. Look, I said it the way that I want to say it, but you knew what I was talking about. So I don't even want to hear it. Okay? Here we go. Question number 8. JP has been diagnosed with gout and wants to know why, is it caucasine? Colchicine, somebody give me the pronunciation in there, is used to treat gout. Which of the following actions explains why it is effective for gout? Replaces estrogen, decreases infection, decreases inflammation, or decreases bone demineralization. Yeah, somebody go ahead and break out Webster's and go ahead and put how to say in there. That way I'll just, you know, figure my life out and go cry in the corner because I can't pronounce shit right. Colchicine. Colchicine? Okay. It's pronounced chai. 15 seconds. I'm sorry. I don't know if y'all know this, but I'm childish. Chai. Look, I see the medication. I'm like, I know what it's for. Look, I ain't in the spelling bee, okay? Chai. All right, y'all. Here we go. Here we go. The steno girl, yo, you got to give me one. You can't give me both. This isn't select all that apply. Colchicine. See, look, that sounds better. Colchicine. Look, colchicine. All right, here we go. Here's our answer in 3, 2. And the answer is C. It decreases inflammation. She's just like, oh my God, Bree, you got it right. All right, here we go. The action of colchicine is to decrease inflammation by reducing the migration of leukocytes to synovial fluids. Like, I had to sit there and actually try to figure it out. I'm not a nurse. I don't know what that means. You're not a nurse? I know that you're not a nurse. Maybe. I don't know. Hey, physiological adaptation, third largest section. Here we go. Shout out to y'all for helping me. You're a CNA. I appreciate all of my CNAs. Shout out to all my CNAs and everybody that's out there. Question number 9. Norma asked for information about osteoarthritis. Which of the following statements about osteoarthritis is correct? It's rarely debilitating. It is a rare form of arthritis. It is the most common form of arthritis, or it only affects people over the age of 60. What are we doing? What are we doing? We got C's. Appreciate all of y'all following. Here is the breakdown. Oh, there goes Manasa. Hey, so Manasa, she's my moderator. So shout out to you, Manasa, for being here. She'll answer questions if I can't answer them. So, is that Jesselyn or Jesselyn? Ma'am, thank you for the follow. Appreciate you. Hey, I want to know who you are, where you're from, where you're at in your nursing journey. Nicole, thank you for the follow. All right. I want all the chisme. I want all the tea. Let me know. Let me know where you're at. All right, here we go. Here is our answer. Nicole, thank you for the follow. Here's our answer in 3, 2, and the answer is C. Osteoarthritis is the most common form of arthritis and can be extremely debilitating. It can afflict people of any age, although most are elderly. I know people that have osteoarthritis and they're like in their 30s. So appreciate the whatever. Thank you, Cassandra. Thank you. Appreciate you. Graduated in May. Shout out to you, Maggie. All right. Hey, physiological adaptation, y'all. Third largest section on NCLEX. First year as an MA doing prerequisite nursing school. Shout out to you, ma'am. Shout out to you. Here we go. Question number 10. Question number 10. Hey, y'all are rocking it. Y'all are rocking it. Ruby is receiving thyroid replacement therapy, develops the flu, and forgets to take her thyroid replacement medication. The nurse understands that skipping this medication will put the client at risk for developing which of the following life-threatening complications? Is it exophthalmos? There it is. Thyroid storm, myxedemic coma, or tibial myxedema. We got B's, we got some C's, we got some C's, we got some. So here, when I tell you guys to paint the picture, think about it. What type of thyroid patient is taking thyroid replacement medication? Yeah, Camille says hypo. Okay. And so once you figure out that it's hypo, okay, what can happen if my patient keeps going hypo? We got myxedema, we got hypo, we got C. I'll give y'all 10 seconds. Shout out to all 179 here. Shannon, thank you for the follow. Okay. All right. So think about those things. A and C are for hyper. Okay. All right. Is it Kara? Thank you for the follow. All right. Well, let's figure out what the answer is. Here it is in 3, 2, and the answer is myxedema coma. So that's C. So myxedema coma, severe hypothyroidism, is a life-threatening condition that may develop if thyroid replacement medication is not taken. Right? Shout out to you, Miss Sanchez. Shout out to you. There you go. I'm smart. Come on, Aquarius. We all smart up in here, kind of, sort of. You know, some of us are nurses and maybe not so smart. I'm just playing. Here we go. Hey, pharmacology, parenteral therapies, second largest section on the NCLEX. All right, hey, so real quick, hey, pausing for a commercial break. We're doing NCLEX questions. Make sure you guys participate. I'm kind of funny. Obviously, I don't know how to say words or spell, but whatever. Make sure you guys give me all them likes, give me all them gifts, give me whatever you want. Give them all to me. Don't troll my chat. If you troll my chat, I'm going to ban you, or somebody's going to ban you. I got these questions off nurselabs.com. Like I said, 7-day NCLEX course, pre-launch, $48. Go check it out. Also, if you want one-on-one coaching, that link is also in my bio. Also, go and check it out. Here we go. What'd you say? It says smartest patient transfer right now. Okay. This is why I'm studying for optometry instead. Look, you got your own stuff going on over there. Screenshot these for future reference. Is that Alicia? Is it Alicia or Alicia? If it's Alicia, give me 1. If it's Alicia, give me 2. Just want to make sure I'm pronouncing names right. All right, so here we go. Here is our question. Nurse Sugar, that sounds like a stripper, but whatever, you do you, boo. Is assessing a client for Cushing's syndrome. Which observation should the nurse report to the physician immediately? Pitting edema in the legs, an irregular apical pulse, dry mucous membranes, or frequent urination? Nurse Sugar, what up? Oh my God. All right, what are we thinking? Shout out to all 200 plus y'all in here rocking with me. We're doing NCLEX questions. I want to know who you are, where you're from, where you're at in your nursing journey. Make sure you guys smash that like button. Don't be greedy. Make sure you guys share to also not be greedy. Make sure you guys follow because apparently my new name is Nurse Sugar and I got an OnlyFans. I'm just playing. Oh, Cushing's is too much calcium. Is it? Irregular apical pulse. Last semester LPN school. Shout out to you. BA in RN or BA in nursing school. Okay, shout out to you. All right, y'all. 5 seconds. A and B. Can't give me and. You got to give me 1. Passed my NCLEX in July. Shout out to you, Liz. Welcome. Or not welcome, but you've been in the shit show for a little bit, so I appreciate you being here. All right, y'all. Here we go. Here we go. Here's our answer. Here's our answer in 3, 2. And the answer is B, an irregular apical pulse. Because Cushing's syndrome causes aldosterone overproduction, which increases urinary potassium loss, the disorder may lead to hypokalemia. Therefore, the nurse should immediately report signs and symptoms of hypokalemia, such as irregular apical pulse, to the physician. MedTech in Texas. Shout out to all my folks in Texas. Who said that? Becca says yes. Wait, can I call you that? I'm gonna call you that, Becca. Becca. Elsa. I'm sorry, Becca. You know what I'm saying. So shout out to all my folks in Texas. You already know how we do. Make sure y'all like, share, follow. Physiological adaptation is the section that it falls from. Here we go. Question number 12. Cyril, whoever that person is, with severe head trauma sustained in a car accident is admitted to the ICU. 36 hours later, the client's urine output suddenly raises above 200 mLs an hour, leading the nurse to suspect diabetes insipidus. Which laboratory findings support the nurse's suspicion of diabetes insipidus? Is it above normal urine and serum osmolality levels, below normal urine and serum osmolality levels, above normal urine osmolality levels, below normal serum osmolality levels, Lord have mercy, or below normal urine osmolality levels, above normal urine or serum osmolality levels? Man, that is a tongue twister. Say it 5 times. Valerie says A, because, Valerie says that these are too easy. User 39. Appreciate the rose. I appreciate it. Hey, y'all nice out here. Appreciate the follow. Hold on. My brain got to process. Does not compute. Looking ass. I'm just playing. All right, what are we thinking? 15 seconds. Got A. Nobody says C. Okay. Pink Glocks. Oh, okay. That's how we roll out here. Mischief says C. Mischief. I got you. I don't even understand C and D. Look, I'm trying to tell you. Sometimes reading them, I now have a headache. No, for real. That's what I was like. Wait a damn. A. Final answer. All right, I got you. All right, here we go, y'all. Here we go. Here's our answer. Here's our answer in 3, 2. And the answer is D, below normal urine osmolality levels, above normal serum osmolality levels. In diabetes insipidus, excessive polyuria causes dilute urine, resulting in below normal urine osmolality level. At the same time, polyuria depletes the body of water, causing dehydration that leads to an above normal serum osmolality levels. Yes. Wealth Coach, thumbs up. Times 3. Kate says, oh, okay. So, physiological adaptation, I got it backwards. That's okay. Dang, my bad, Caitlin. It's all good. It's all good. Oh, no, that would have been a lawsuit for me. What do you... Why? Because you got the answer? What time do I do my lives? I do my lives Monday, Wednesday, Fridays at 5:30 Central Standard Time, a.k.a. Texas time, because that's the only time that matters. Next. I'm just playing. But here we go. Question number 13. Jamari is diagnosed with hyperosmolar hyperglycemic non-ketotic syndrome, or HHNS. NCLEX. Say that, 5 times fast. And is stable and prepared for discharge. When preparing the client for discharge and home management, which of the following statements indicates that the patient understands her condition and how to control it? So the topic for this one is just like, hey, you understand the education. So what is the correct statement that the patient is going to make, right? Is it, I can avoid getting sick by not becoming dehydrated or and by paying attention to my need to urinate, drink, or eat more than usual. If I experience trembling, weakness, and headache, I should drink a glass of soda that contains sugar. I will have to monitor my blood glucose levels closely and notify the physician if it consistently elevates. If I begin to feel especially hungry and thirsty, I'll eat a snack high in carbohydrates. So what do we got? What do we got? Somebody gave me 6 roses. I appreciate you. Sorry, y'all. My son, I swear to God, every single time I get on a live, this dude is just like, how can I fucking hurt myself now? My dude's always hurt himself. So if y'all hear him scream, nah, he ain't mad. He hurt himself. He 18 months. He grown. He do what he want. So, all right, here we go, y'all. Here we go. Here is our answer. Here's our answer. That baby is how I felt reading that first question. Look, man, I'm just trying to tell you. A, final answer. All right, cool. Here we go. Here's our answer in 3, 2. And the answer is A. I can avoid getting sick by not becoming dehydrated and by paying attention to my need to urinate, drink, or eat more than usual. Ashley, thank you for the follow. So inadequate fluid intake during hyperglycemic episodes often lead to HHNS. By recognizing the signs of hyperglycemia, polyuria, polydipsia, and polyphagia, and increasing fluid intake, the client may prevent HHNS. Appreciate the follows. Appreciate y'all. The section is the health promotions and maintenance. That's one of the smaller sections on NCLEX. But hey, those smaller sections will really, really make a huge difference on you passing versus you not passing. All right. I got to get it together before, ma'am, you got to get it together. All right. Here we go. Question number 14. A 66-year-old client has been complaining of sleeping more, increased urination, anorexia, weakness, irritability, depression, and bone pain that interferes with her going outdoors.
Kevin hit his nose and is bleeding.
Oh, my God. Hey, y'all hold on 1 second. Don't go nowhere. All right, y'all. Appreciate y'all sticking around. Hey, this is what happens. Hey, any of y'all got kids, y'all already know what the deal is. Y'all already know what the deal is. So daddy had to go and, do a neurological assessment on a baby. He ain't even paying me no attention. Now his ass is watching Bubble Guppies. My man, Jesus fucking God. Anyways, let's go. All right, here we go, y'all. Here we go. Here's our answer in 3, 2. And the answer is D. Hyperparathyroidism is most common in older women and is characterized by bone pain and weakness from excessive parathyroid hormone. Clients also exhibit a hypercalciuria causing polyuria. So, knew it was the kids. Of course, you already know it's the kids. You already know what's up. I'm just saying, it's just like, damn, dude. I swear, if y'all go back and y'all look on my YouTube on how many times you hear this dude either at the door or screaming, I'm just like, Jesus Christ. Toddlers scare you? Hey, he 18 months and he living here rent free. And he causes the most destruction. Oh my God. But I appreciate y'all rocking, appreciate y'all staying. Daddy got to go do daddy things, and daddy's a nurse, so daddy is nursing daddy things. So here we go. Question number 15. Nurse Lords is teaching a client about Addisonian crisis, about the need for, is it fludrocortisone, acetate, and hydrocortisone at home. Which statement by the client indicates an understanding of the instruction? I'll take my hydrocortisone in the late afternoon before dinner. I'll take all of my hydrocortisone in the morning before right after I wake up. I'll take 2/3 of the dose when I wake up and 1/3 late in the afternoon, or I'll take the entire dose at bedtime. What are we thinking? Appreciate y'all hanging out while, daddy goes and does daddy duties, so TikTok live don't be going nowhere, but I'm here for y'all. Y'all know what the deal is. Make sure you guys like, share, follow, smash that like button, y'all. Hey, I need like 20,000 likes. I need to stop playing games with me. And then also make sure you guys share. Don't be greedy your whole life. All right. And make sure you follow me, because I'm kind of cool sometimes. Some people don't like me because, I tell the truth and no part of me cares. So we got B's. Okay. Got B's. Who is that? Apple user? I thought that said applesauce. I was just like, applesauce. What? C, final answer. All right, cool. This is, Who Wants to Be a Millionaire? I appreciate you. All right, y'all. 5 seconds. What are we thinking? 5 seconds, y'all. 5 seconds. What are we thinking? All right, so we got C's. All right, cool. Here we go. Trinity, thank you for the follow. Chorizo the cat, thank you for the follow. All right, here we go. Here's our answer. Here is our answer in 3, 2, and the answer is C. I'll take 2/3 of the dose when I wake up and 1/3 in the late afternoon. Hydrocortisone, a glucocorticoid, should be administered according to the schedule. The schedule that closely reflects the body's own secretion of this hormone. Therefore, 2/3 of the dose of hydrocortisone should be taken in the morning and 1/3 in the late afternoon. This dosage schedule reduces adverse effects. How y'all feel about that one? How y'all feel about that? Is that Raquel? Raquel, appreciate the follow. Thank you. All right, so hey, health promotions and maintenance. That's what we're doing. Hey, today is Friday, y'all. Today is Friday. Your boy got military duties that he got to do tomorrow. So, he gonna be rocking with y'all after we get finished with this. See how y'all feeling about stuff. All right, here we go. Hey, so real quick, doing NCLEX questions. Make sure you guys participate. Give me all them likes. Give me all them gifts. Give me all them follows. Give me all that. Give me all that. Don't troll my chat. You troll my chat, I'ma ban that ass. All right, so don't be rude, okay? Nurselabs.com is where I got these questions from. 7-day NCLEX course, and it's pre-launch. $48. Once you get it, it is yours forever. You get all the updates and all that good jazz. Hey, and if you want one-on-one coaching, for NCLEX, you can book a free call with me, and we can talk about if coaching is good for you or right for you. So check that out. Here we go. So, whoa, what is this? What'd I do? Okay, here we go. Question number 16. Waiting to take my NCLEX. Okay, shout out to you, Raquel. Which of the following laboratory value or laboratory results would suggest to the nurse, Lynn, that a client has a corticotropin secreting pituitary angioma? What are we thinking? What are we thinking? Shout out to 80 of y'all. Man, as soon as I do a commercial break, people are just like, don't want to hear it. Gotta go. Oh my God. Appreciate it. Hey, I want to know who you are, where you're from, where you are at in your nursing journey. I want to know all that. Y'all drop it down. Hey, and if you're new here, I especially want to know that. All right. All right. We got some C's. We got some A's. Okay. Maybe A. Okay. All right. All right, we got B, we got B, we got B. All right. Okay. All right. Let's check this out. St. Louis, Missouri, St. Louis. All right, here we go. Here we go. Here's our answer in 3, 2. And the answer is C. What is it? A corticotropin pituitary, secreting pituitary tumor may cause a high corticotropin and high cortisol levels. This is part of the reduction of risk potential. So it's one of the smaller sections on NCLEX. But as a matter of fact, I just got word that I shouldn't have skipped that one and I should go back. So I'm going to go back before I get yelled at. All right. So here we go. Just in case anybody is wondering how much of the NCLEX. So the below is the breakdown of the percentages of each question type and section on NCLEX. So management of care makes up 20%. Physiological adaptation makes up 14%. Pharmacology makes up 15%. Those are the 3 largest sections on the exam, right? And then you have reduction of risk potential, safety and infection control that are 12%. And then you have basic care and comfort, psychosocial integrity, and health promotions and maintenance at 9%. Those are those things that you got to know. Those are the things that you got to remember. It said, are you describing the new generation NCLEX? No. Wait, what are you talking about? If you're talking about for percentages, yes. Farm is my nemesis. Yeah, yours and everybody else's. All right, here we go. Question number 17. A male client is scheduled for a transphenoidal hypophyseectomy. Oh my God. To remove a pituitary tumor. Preoperatively, the nurse should assess for potential complications for which of the following? Is it testing for ketones in the urine, testing urine specific gravity, checking temperature every 4 hours, or checking capillary glucose testing, or performing capillary glucose testing every 4 hours? We got B. So yeah, whoever said that, Savannah, so the NCLEX hasn't changed in regards to how they break down questions, or even the percentages. Some of them they've gone up like 1 point or less down 1 point, so on and so forth. So I feel like I've seen this question before. You might have, Camille. You might have. So shout out to all 72 of y'all, 74 of y'all actually. I want to know who y'all are if y'all are new here. I want to know who you are, where you're from, where you're at in the nursing journey. Let us know. Make sure you smash that like button. Make sure you follow. And make sure you share. So don't be greedy. Don't be greedy your whole life. All right. 5 more seconds. Coco, thank you for the follow. All right, y'all. ATL, I see you out there. Fever equals cancer surgery. You know that's right. Here we go, y'all. Here we go. Here's our answer in 3, 2. And the answer is D. Perform capillary glucose testing every 4 hours. The nurse should perform the capillary glucose testing every 4 hours because excess cortisol may cause insulin resistance, placing the client at risk for hyperglycemia. Detroit, Michigan. Shout out to you, ma'am. Cinnamon the Dawn. All right. Hey, so reduction of risk potential. Hey, it's okay. It's okay. It's all right. Hey, you're not expected to get them all right. You're not expecting to get them all right. All right. So here we go. Here is our next question. Question number 18. Capillary glucose monitoring is performed every 4 hours for a client diagnosed with diabetic ketoacidosis. Insulin is administered using a scale of regular insulin according to glucose results. At 2 p.m., the client has a capillary glucose level of 250 milligrams per deciliter, for which he receives 8 units of regular insulin. Nurse Mariner, whoever the fuck that is, Nurse Mariner should expect the dosage onset to be at 2 p.m. and a peak to be at 3, onset to be at 2:15 with a peak to be at 3, onset at 2:30 to be with a peak to be at 4, or onset at 4 with a peak to be at 6. So what are we thinking? First of all, we need to know, hey, what does it mean when our patient has diabetic ketoacidosis? Are they stable or are they unstable? If you're LPNs, if they have diabetic ketoacidosis within the last hour to 4 hours, can you take them? Because they're unstable, right? You LPNs, you guys can't take them, right? I don't care what nobody tells you. Doesn't it matter what kind of insulin? It says the insulin right there. So this is where pathophysiology, when you're understanding the disease process in regards to diabetic ketoacidosis, is so important, especially when you're working the floor or if they come into your ER. Okay, 15 seconds. So hey, if I have somebody with diabetic ketoacidosis, what is one of the biggest things that I'm worried about? Regular insulin onset, 15 to 30 minutes with a peak to 45. Okay, shout out to you, Camille. Look at you, smarty pants. Dehydration, right? Time. What's the big thing that's happening with somebody who somebody is in DKA? C, final answer. Okay. All right, here's our answer, y'all. Here's our answer. Here's our answer in 3, 2. And the answer is ketones, right? So our answer is onset at 2:30 with a peak at 4. Regular insulin, which is a short-acting insulin, has an onset to 15 to 30 minutes with a peak to 2 to 4 hours. Because the nurse gave the insulin at 2, the expected onset would be 2:15 to 2:30 with a peak of 4 to 6. Pharmacological and parenteral therapies, metabolic acidosis. So what is increased when somebody has DKA? When somebody is in DKA, what is an electrolyte that is high that we need to fix? Which regular insulin fixes by pulling it out of what to pulling it into what? Yes, there you go. That's what's important, because what's going to happen if you have a potassium that's too high? Potassium too high, baby, you finna die. You see what I'm saying? That's what it pushes it into the cells and out of the blood, out of the vessels, right? Heart. There you go. That's what I'm talking. Y'all so smart. Y'all up in here saying that y'all ain't smart. Stop playing games with me. You know what I'm saying? I got some smarty pants up in here. All right, here we go. Question number 19. The physician orders laboratory test to confirm hyperthyroidism in a female client with classic signs and symptoms of the disorder. Which test result would confirm the diagnosis? What would it be, y'all? What would it be? No increase in the thyroid stimulating hormone level after 30 minutes during the TSH stimulation test. A decreased TSH level. An increase in the TSH level after 30 minutes during the TSH stimulation test. Or is it D, below normal levels of serum T3 and serum T4 as detected by radio immunoassays? We got D. I definitely wasn't going to try to say that, and I don't care what you say. D, I think that's fair. You think it's D, then it might be D. Maggie. Shout out to all 197 of y'all. Appreciate y'all. I want to know who you are, where you're from, where you're at in your nursing journey. Make sure you guys smash that like button. Don't be greedy. Make sure you guys share to somebody, because don't be greedy. And then make sure you follow me. And don't be greedy. 15 seconds. So we got A's, we got B's, we got hypo. Take my NCLEX in 2 weeks. Shout out to you, Eliza. Appreciate Amber, Samantha, V, Marie. Thank you for the follows. Appreciate you. All right, y'all. Here we go. Here's our answer. Our answer is coming up in 3, 2. And the answer is A. No increase in the thyroid stimulating hormone level after 30 minutes during the TSH stimulation test. In the TSH test, failure of the TSH level to rise after 30 minutes confirms hyperthyroidism. You read it backwards. Hey, if you're new here, or if you're somebody who comes here all the time, what does RTFQ mean? If you're a regular and you come to my streams or you come to these lives, what does RTFQ mean? Right? Because somebody just said levels are read backwards, but also when we were reading these questions, what do you want to do? Good gal, appreciate the follow. Hey, reduction or risk potential, okay? Read the effing question. Camille, you so smart, girl. That's what I'm talking about. Caitlin, you so smart. That's what I'm talking about. Here we go. Question number 20. Rico. Uncle Rico. He probably does have type 2 diabetes and Napoleon Dynamite. Anyways, Rico with diabetes mellitus just learned how to self-administer insulin. The physician has prescribed 10 units of U100 regular insulin and 35 units of U100 of isophane insulin suppression (NPH) to be taken before breakfast. When teaching the client how to select and rotate insulin injection sites, the nurse should provide which instruction? What are we doing? First timer, love it. Maggie, I appreciate you being here. Hey, we kind of act up in here sometimes. Mostly it's just me, and then people just laugh at me, and I don't know why. Appreciate who is that? I appreciate the share. We got B's. Okay. We got B's. B. Camille, where you at? Where your answer at? Pink Glock says B. I can't get over the name. Some of y'all got some wild ass names. Samantha says definitely B. All right, Samantha. I hear you. Rachel says B. All right, what are we thinking? Hey, if you're new here, I appreciate you being here. We're doing NCLEX questions. Elaine says B. Okay, B, final answer. Can you read A, please? A says inject insulin into healthy tissue with large blood vessels and nerves. All right, here we go. I'll give that 10 more seconds since I just read that, since there's always a delay. I appreciate y'all. B. Yup. Here we go. Here we go. All right, here we go. Here's our answer. Here's our answer in 3, 2. And the answer is B. You want to rotate injection sites within the same anatomic region, not among different regions. The nurse should instruct the client to rotate injection sites within the same anatomic region. Rotating sites among different regions may cause excessive day-to-day variations of the blood glucose levels. Also, insulin absorption differs from different regions to the next. Yep, lipodystrophy, lipodystrophy, hyperdystrophy. You already know what the dystrophy is. The other ones didn't make sense. Hey, if the other ones didn't make sense, then baby, you know what the answer was. Here we go. Hey, health promotions and maintenance. All right, appreciate y'all. Here we go. Hey, real quick, commercial break. Don't go nowhere. NCLEX questions we're doing. Participate. That's what I want. Gifts. That's what I want. Give them all to me. 600s. I'm going to ban you if you act up. I don't want that, but don't be rude and I won't ban you. I haven't banned nobody today, so we're good. Nurselabs.com is where I got the questions. 7-day NCLEX course. Y'all can check that out. Also, y'all can check out thebootnurse.com. Hey, also, I'm going to be doing group coaching, so y'all be on the lookout for that. Group coaching is coming. It's coming, baby. All right, here we go. Question 21. Felicia. Bye, Felicia. Oh, you knew that was coming. Girl, you knew that was coming. You knew here? Please stay here. I didn't mean that. I'm just playing. Here we go. Nurse Sarah expects to note an elevated serum glucose level in a client with hyperosmolar hyperglycemic non-ketotic syndrome. Which other laboratory finding should the nurse anticipate? Elevated serum acetone levels, serum ketone bodies, serum alkalosis, or below normal serum potassium levels? Who is that? Is it Sherry? Sherry said that you're new. Hey, I appreciate you being here, Sherry. I hope you following, you know what I'm saying, since you're new here. But yeah, if you're new here, hey, we're doing NCLEX questions. Welcome, welcome. I want to know if you're new here. I want to know who you are, where you're from, where you're at in your nursing journey. You know, we're talking about NCLEX questions right now. When we get finished with these questions, I'm going to do a Ask Me Anything. I do it after every time I do questions. So, Boot Nurse, I'm a pre-med student and I love these lives. That's what I'm talking about. You're a pre-med student, I'm about to make you a nurse. I'm just playing. You go be med student and go be a doctor. New here from Puerto Rico. Shout out to the PR. I know some folks from there. You know what I'm saying? Here we go. Here's our answer, y'all. Here's our answer. I passed my NCLEX last week. Shout out to Sam B14. Shout out to you. Welcome to the shit show. Here we go. The answer is D, below normal serum potassium levels. A patient with HHNS has an overall above deficit of potassium resulting from diuresis, which occurs secondary to hyperosmolar hyperglycemic state caused by the relative insulin deficiency. I take my NCLEX on Wednesday. So next Wednesday, that's coming up. Okay, because obviously today is Friday. So on Tuesday, Gabby, Gabriella, whatever your name is, on Tuesday, I'm going to need for you to not be nowhere near nothing. You need to be relaxing that mind. Better said than done. But that's what you need to be doing for yourself. That's what you need to be doing. That's what you need to be doing for yourself. I'm in my final year of nursing school. That's what I'm talking about, Angel. All right, here we go. Question number 22. For a client with Graves' disease. Now, what is Graves' disease? Think about that. Which nursing intervention promotes comfort? Restricting intake of oral fluids, placing extra blankets on the client's bed, limiting intake of high carbohydrate foods, or maintaining room temperature in the low normal range. Hyperthyroid son. Okay, got you. I'm picking up what you're putting down, Eliza. We got D's, we got C's, okay. All right, what else we got? I'll give y'all 15 seconds. First semester in my LPN to RN Bridge program. Shout out to you, Marie. You gonna get there. I'm new from Wisconsin. LPN one more semester to my RN. That's what I'm talking about. Millie. Anybody know anything about Millie and Vanilli? I'm probably showing my age. That's probably outside my age range anyway. So shout out to all 150 of y'all. We're doing NCLEX questions right now. Make sure you guys like, share, smash that like button. Make sure you guys follow and make sure you guys share. Don't be greedy your whole life. I do. D. Okay, I'm graduating nursing school in December. Shout out to you. Hyperthyroidism, intolerance, Millie Van. I heard of them. They were fraud singers. They were lip syncing, on some Ashley Simpson shit on Saturday Night Live. All right, here we go. Here's our answer. And 3, 2, blame it on the rain. Yeah. All right, here we go. Maintain room temperature in the low normal range. Graves' disease. causes signs and symptoms of hypermetabolism, such as heat intolerance, diaphoresis, excessive thirst and appetite, and weight loss. To reduce heat intolerance and diaphoresis, the nurse should keep the client's room temperature in the low normal range. This is part of basic care and comfort. So remember, hyperthyroidism is Graves' disease. So you want to everything is up. Everything is up. Heat intolerance. They're diaphoretic because they're sweating. They're excessively thirsty. They have an appetite. And with all that stuff going up, I lose weight, right? Remember, run yourself into the grave. You want to run yourself into the grave. Who said that? It says now a lot of the artists lip sync. That's all they do now. They need to give. Hey, I'm just trying to tell you, to be completely honest, is you'll go to a Lil Wayne concert, that fool will forget and he'll just put the mic towards the audience and they'll sing it. So if I wanted to do that, I'd just sit my ass in the shower and sing a song. All right, here we go. Patrick is treated in the emergency department for a collis fracture sustained after a fall. What is a collis fracture? Is it a fracture of the distal radius? Fracture of the olecranon, whatever. Fracture of the humerus or fracture of the carpal scaphoid. We got A's. We got some C's. We got some D's. Is it Brielle? Brielle says A. Okay. I'm going with the majority of the chat. She's like, I'm just following the fucking crowd. I got you. I'm completely guessing. So you're going to say B. Peyton. That's all good. Pronounce Coles. Okay, cool. Look, like I said, not a spelling bee, not that dude. I'll pronounce it wrong. You'll know what the hell I'm talking about. Marty says A. Bruh, can't even pronounce. Yeah, you're right. I can't. Just like I said. You must be new here. All right, here we go. Ryan, appreciate the follow. Camille says D. Leanne says D. What's the answer? I don't know, Jordan. I'm trying to get there. I didn't know we were on your time. All right, here we go. Here's our answer, y'all. Here's our answer in 3, 2. And the answer is A, the fracture of the distal radius. The Coles fracture is a fracture of the distal radius, such as from a fall on an outstretched hand. It's most common in women. Thanks for the answer. You're welcome. You're so sassy. You already know. Hey, don't be coming over here trying to rush me. All right. I didn't know we were on y'all's time. You know what I'm saying? So here we go. Hey, physiological adaptation, third largest section on NCLEX. Okay. Question number 24. Cleo is diagnosed with osteoporosis. I'm petty. I'm sorry. Which electrolytes are involved in the development of this disorder? Is it calcium and sodium, calcium and phosphorus, phosphorus and potassium, or potassium and sodium? B. Jordan wants to know the meaning of life. Bro, I really wish I could tell you. I don't even know. I might write a book on that. Ryan is screaming B's. All right, I got you, Ryan. I see you. Most definitely B. Okay, I got you, Cinnamon. Felicia, you still here? Girl, I appreciate you. All right, I'll give y'all 10 more seconds. Miss Parker says B. Miss Parker. Shout out to all 185 of y'all up in here rocking. Is it Gian? Appreciate the follow. Hey, I want to know who you are, where you're from, where you're at in your nursing journey. We are going over NCLEX questions. I got these questions off nurselabs.com. Check them out. Here we go. Here's our answer in 3, 2. And the answer is calcium and phosphorus. In osteoporosis, bones lose calcium and phosphate salts, becoming porous, brittle, and abnormally vulnerable to fractures. I'm from Florida. Shout out to Florida. I lived there for a couple years. You know what I'm saying? So got an since Friday out of high school. 6 months I graduate RN. I'm a new nurse this past my NCLEX. Shout out to you, Molly. Shout out to hey, everybody give Molly some love. You know what I'm saying? Let her know. Welcome to the shit show. Being a nurse, you know, that's how we do. Georgia says I'm a wound care coordinator here. Shout out to you, Samantha. I used to work in a burn center and I didn't coordinate wound, but we learned a lot about wound care there. I loved it. Physiological adaptation, y'all. That's where we're at. That's the section that it comes from. All right, here we go. Question number 25. Currently a phlebotomist and CNA. Shout out to you, Angel. I see you. A sounds like right too. Okay. I'm in my prereqs. Okay. Good luck, Ginger. Wait, is that somebody's name? All right, here we go. Question 25. Johnny, a firefighter was involved in extinguishing a house fire and is being treated for smoke inhalation. He developed severe hypoxia 48 hours after the incident, requiring intubation and mechanical ventilation. He most likely has developed which of the following conditions? Is it adult respiratory distress syndrome, atelectasis, bronchitis, or pneumonia? Look, I tried to say this word not too long ago, and I still fucked it up. So, my bad. A for sure. No. Look, I'm sorry. I'm just keeping it all the way real. Some words your boy just don't know how to say. All right, I'm 15 seconds. I can never say. That's like some people can't even say aluminum. They're like aluminium. Look, don't atelectasis, atelectasis, atelectasis. I'm over here saying it like a speak and spell. Earthy, appreciate the follow. All right, y'all, 5 seconds. 5 seconds. All right, cool. Here we go. In 3, 2, and the answer is A. Talking about adult respiratory distress syndrome. Severe hypoxia after smoke inhalation is typically related to ARDS. All right. Hey, with nurselabs.com, they don't really go into a lot of the details for the rationales. However, if you decide to purchase something else later on down the line, then, those things go a little bit more into depth, like, Kaplan or Hearst or UWorld or Archer or whatever. Those things have those, right? So physiological adaptation, third largest section on the NCLEX. Appreciate the follow. Adolescence. All right, real quick, commercial break. We're doing NCLEX questions. Participate. Give me them gifts. Give me them likes. Don't troll my chat. You troll my chat, I'm going to troll you back. I'm just let you know. You act the fuck up, I'm going to ban that ass. Just saying. Don't be rude. Nurselabs.com is where I got the questions. 7-day NCLEX course. That link is in my bio. And if you want one-on-one coaching for the NCLEX, you can book you a 15-minute free consultation. Check that out. That link is also in my bio. All right, here we go. Question number 26. A 67-year-old client develops acute shortness of breath and progressive hypoxia, requiring right femur. Didn't write it. The hypoxia was probably caused by which of the following conditions? Asthma attack, atelectasis, bronchitis, or fat embolism. Now I'm just playing with y'all. All right, what are we thinking? I appreciate all 147 of y'all here rocking with me. I want to know who you are, where you're from, where you are at in your nursing journey. We are doing NCLEX questions. I want to know all that. I want all the chisme about you and where you are in your journey of becoming a nurse, whether it be an RN or an LPN, because LPNs, y'all are nurses too. Don't let no motherfucker tell you that you're not. Trust and believe. Femur key. Bro, say it. Atelectasis. Jeez, man. Yeah, you said you heard what I said. All right. 10 seconds. Nia. Yeah, I got you. From Canada. Canada, eh? Shout out to you. Yes, we nursing one. All right, here we go, y'all. Here we go. The grammar of this question. Yeah, it's terrible, Sherry. It really is. I didn't write it. So here we go, y'all. Here we go. Here's our answer in 3, 2. It's D, fat emblem. I'm just looking at y'all like put freaking atelectasis inside of the... Hey, I'm going to get better. I promise. I won't be a shitbag my whole life. I promise. Long bone fractures are correlated with fat emboli, which cause shortness of breath and hypoxia. I can't even tell you how many pulmonary embolisms I've seen during my COVID days when it happened in the ICU. That shit is wild. And trust me, when you see it, you will never forget what somebody who has a PE. So what do you mean? Oh, damn, that's mean, Manasa. Damn. Okay, whatever. Physiological adaptations. Atelectasis, like lettuce. I say atelectasis. Look, you know what I'm talking about, though. Hey, I don't appreciate being roasted. I'm about to give everybody in here a 600. Every one of y'all. Question 27. A client with shortness of breath has decreased to absent breath sounds on the right side from the apex to the base. Which of the following conditions would best explain this? Is it acute asthma, chronic bronchitis, pneumonia, or spontaneous pneumothorax? What are we thinking? Oh, so everybody's screaming to answer at me now. Okay. D. All right, cool. Most recent 12 is D. Oh, shit. I didn't know that TikTok. Okay, so that's like the unanimous answer. TikTok lets me know. Is it Lavia? Appreciate the follow. Make sure you guys give me those follows. Give me those likes. And make sure you guys share. Don't be greedy your whole life. Angie, appreciate the follow. I'll give y'all 6 seconds. I got bronchitis. I ain't had no shoes or nothing, Jesus. All right, here we go, y'all. Here's our answer. In 3, 2. Yeah, that shit hurts. I bet it does. All right, here we go. And the answer is D, spontaneous pneumothorax. It occurs when the client's lung collapses, causing an acute decrease in the amount of functional lung used in oxygenation. The sudden collapse was the cause of his chest pain and shortness of breath. Physiological adaptation. Hey, so physiological adaptation consists of, like acute and chronic, injuries and trauma and care. So when you see questions like that, think about that's where they fall under. Yeah, I got it right. Shout out to you. Shout out to you. All right. So physiological adaptation, that's where that one falls under. All right. So, hey, shout out to all 200 plus of y'all up in here. We're doing NCLEX questions. Question number 28. A 62-year-old male client was in a motor vehicle accident as an unrestrained driver. So you already know, probably through the damn windshield. I've seen that happen before, too. He's now in the emergency department complaining of difficulty breathing and chest pain. On auscultation of his lung field, no breath sound are present in the upper lobe. This client may have which of the following conditions? Bronchitis, pneumonia, pneumothorax, or tuberculosis. Got C. Okay. Hey, so it's crazy when you guys start answering like the same number or the same letter, TikTok lets me know like, hey, you've had these consistent ones in a row. So I think that's pretty cool. Hey, so we're doing NCLEX questions. If you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. I want you to smash the like button. I want you to follow, and I want you to share, because I don't want you to be greedy your whole life, because you're better than that. Ariel, it says, how is it that I can get these, but taking my test in school seems like I don't know shit? Ma'am, I don't know. It could be that anxiety. I'm an RT. Steph, I love you. You're an RT. I learned so much from the vents, or so much from RTs on how to do vent management. I love it. Love every bit of it. So shout out to you. Here we go, y'all. Here's our answer. Here's our answer in 3, 2. And the answer is, of course, C. A pneumothorax is defined as the presence of air or gas in the pleural cavity, which can impair oxygenation and or ventilation. Hi, my name is Sophia. I'm an ED tech waiting to get into nursing school. Shout out to you, Sophia. Shout out to you, Sophie. That's my niece's name, so I call her that. You're not my niece, but I will respect you and say your name fully. Miss Parker says I'm from Ohio. Shout out to you. Hello, Dr. Daniel. Is it Yip? Is it Dr. Daniel Yip, MD? Shout out to you, sir. All right, here we go. Question number 29. I just like to study and learn, here for the fun quiz. I'm glad that you're here. If you're here for the fun quiz, you better be following me. Stop playing these games, being all greedy. I'm just playing. I love y'all. Here we go. Question 29. If a client requires a pneumonectomy, what fills the area of the thoracic cavity? The space remains filled with air only. The surgeon fills the space with gel. Serous fluid fills the space and consolidate the region. The tissue from the other lung grows over to the other side. Birmingham, Alabama. Wait a minute. Where did that happen? No, that was in Montgomery. Never mind. Girl. Who said that? Amber Lynn. Hey, I think we talked about this. Make sure you... Hey, folks got to have folding chairs out there. Pink Glock says C. Megan, triage RN from Minnesota. I also do OB and delivery. Shout out to you, Megan. Hello, my name is Vanessa. What does it say? I'm going to give y'all 15 seconds. Nurse 1. I'm so excited to be a future LP, and that's what I'm talking about. Hey, speak things into existence, y'all, and it shall be so. You're talking about, hey, I'm waiting to be an RN. Hey, you will be an RN. Make it happen. You will be an RN. Put it out into the universe, and it shall be so. South Kakalaki, first semester. Leslie's graduating in December. All right, y'all, here we go. Here is our answer. Our answer in 3, 2. And the answer is C. Serous fluids fill the space and consolidate the region. It's preventing excessive, is a medial sinus shift of the heart and the remaining lung. Oh, shit. Hey, shout out to you, Tiffany. Ro, appreciate the share. Is it Romaine? Romaine, thank you for the follow. It was Montgomery. Oh, you're from Montgomery? Look, Amberlyn, you know what the deal is. You got, hey, I went to Walmart and I live in San Antonio, and tell me why there were no folding chairs when that shit happened. I'm like, y'all are something wrong with y'all. Physiological adaptation, y'all. Third largest section on the NCLEX exam. Okay, on the NCLEX exam. Here we go. Question number 30. All right, here we go, y'all. Here we go. Hemoptysis may be present in a client with a pulmonary embolism because which of the following reasons? Alveolar damage in the infarct area. Somebody said that that's like their favorite word is infarct. which something's wrong with you. Involvement of major blood vessels in the occluded area, loss of lung parenchyma, whatever, loss of lung tissue. There we go. What do we got? Infarct. If you guys are new here, we're doing NCLEX questions. Make sure you guys like, share, and you guys follow. Parenchyma. Oh, see, look, I got you. I'll say that one right now. Parenchyma. Ariel, I appreciate you. Y'all know I'm slow. All right, 15 seconds. You're a nurse and you can't pronounce. You're right. I'm a nurse and I can't pronounce it. You must be new here. That's like say, hey, you're a human and you don't know how to take a bath. The fuck? Torn between B and D. Okay. Michael, appreciate the follow. Hey, I just want to let you know, you come in me in my chat and you be sassy, I'm going to be sassy back to you. Ariel, you good? Between A and B. Okay. 10 seconds, y'all. All right, here we go. Here we go, y'all. Here's our answer. Here is our answer in 3, all of them. Wow, really? Here we go. In 3, 2, a super final answer. And the answer is A, alveolar damage in the infarct area. The infarct area produces alveolar damage that can lead to the production of bloody sputum, sometimes in massive amounts. Well, damn. Yeah, you got it right. That's what I'm talking about. Physiological adaptation, y'all. Because remember, physiological adaptation, it covers acute, chronic, trauma and all those other aspects of nursing, right? When it comes to like acute trauma type patients. Okay. All right. Here we go. Hey, that's a wrap on the questions. Right now, we're about to do an Ask Me Anything. So if you guys want to start roasting me for how I can't pronounce shit, oops, sorry. Okay, well, I don't know what you want me to tell you about that. I appreciate y'all participating and hanging out. I love each and every one of y'all. I promise you. That's the only reason I do this. I swear. I didn't have to ban nobody. I will be petty over 9,000. I swear to God. Don't do it. I didn't have to ban nobody, which is great. Check out the 7-day NCLEX course. And then, of course, go to thebootnurse.com. Do you work as a nurse? Yes, I do. All right, here we go. I'm going to turn this thing around so you guys can see just this hideous face that we got going on over here. All right. Hey, so what's up, y'all? What's up? How y'all doing? Hey, so essentially, this is where I like to do like the Ask Me Anything. It could be about nursing. It could be about whatever. Jason Derulo. Thank you, Slick. I missed the answer. I forgot what the answer is. I'm not going back. The answer was A. There you go. Thank you so much, Jason Derulo. Hey, so y'all got jokes? What type of nurse are you? I am an OR nurse. I work in the operating room now. I used to work in the ICU. I've been a nurse for 3.5 years. I did a little bit of time, over a year in the ICU. And then I did a little bit of PACU. And then the rest of the time has been as an OR nurse. So, yeah. So, like I said, 3.5 years. I'm in the military as well. Do you like the OR better? I like the OR better than the ICU, 100%. Mostly it's because the ICU that I was in was a very big shit show. So you do favor. I do. Yeah, I get told that a lot. So what was the hardest course you take? How many times did you give up and kept going? What do you mean, happy mom? Is it Kali? My name is Kali from Minnesota. Shout out to you. That explains the pronunciation. What are you talking about? What are you talking about? Goliath? I don't even know what that means. Where did you go to school? I went to school in Texas. Best studying tips for med-surg. You're talking about the class? So if you're in like med-surg class, my suggestion would be to get in a group, like a study group, like you and like 3 other people, and you guys start studying together. 25% of the work gets you 100% of the results. That's just mine. Study tips for farm, being an OR nurse. What does that even mean? What does that even mean? What's your opinion on new grads starting in med-surg? I think it's great. There's nothing wrong. You guys got to remember that med-surg is a specialty. It's still a specialty. Just because you don't go ICU or you don't go labor and delivery or wherever else, it's still a specialty. I'm about to enter nursing school and I'm so nervous. What course did you think was harder? I don't know. I don't know what you mean. Like by what course? Look, I'm hoping to rejoin school. I miss school. Go do it. Don't hope to do nothing. Make it happen. Med-surg makes you well-rounded. It does make you well-rounded because, you learn about your time management, you learn about, patient assessment, pharmacology, all that stuff. Any tips to calm your anxiety for NCLEX? The tips in my opinion, to calm your anxiety for NCLEX is to recreate the testing center, right? So, no food, no drinks, have a computer right in front of you, like practice like you play. Pharmacology is my downfall, just like for everybody else. Test taking. Oh my God. Waiting on an appeal. Oh, okay. I got you. Did you take an exit exam for nursing school? If so, ATI HESI. I did HESI and it was terrible. Being an OR nurse explains the difficulty in pronunciation because you don't handle those conditions. See, now that there's context and clarification. I appreciate that. So a lot of those is like you won't see them. Even in the OR, even when I worked in the ICU, we didn't. There's a lot of words that we just didn't say. A lot of the words that you'll say in nursing school, some of them you'll never fucking say ever again. But adolescent, I'm just like, oh, okay, well, oops. You should have seen how I seen somebody pronounce ondansetron. It was a autocentron. I'm like, what? Doesn't make them any less different from anything. You'll never say or see it again. Thank you. I work with children. I guess I'm trying to ask your personal opinion in nurse. Oh, so you metoprolol. I hear people say metoprolol. You know, so it's like adolescence. He said, hey, I'm just saying. But to answer your question, they have programs that are out there, you know, but when it comes to the programs that you go to, the biggest thing about nursing school is time management. Like you have to literally cut everything off and schedule your life, especially if you're married, you have children, because nursing school is intense. So, you know, that's what you got to do. Couldn't agree more. Being in clinical time is such different. It really is. I love hearing acetaminophen in different ways. It's funny. Is it Guillain-Barré? Guillain-Barré? I say Guillain-Barré. It's funny because there's a guy that I work with. His last name is Gillian, and he pronounces it Gillian, and it's spelt the same exact way. I'm married to nursing school. You probably are. Hey, so I appreciate everybody being here. Like I said, if you're new here, I want to know who you are, where you're from. We're doing ask me anything nursing stuff. So, yeah. So shout out to y'all for being in here, rocking with me. Literally so much time. Even if I schedule downtime, you're probably still thinking about school. I tell you right now, I went to Vegas after I got finished with a semester and we had like a 2 or 3 week break and all I thought about was school. Guillain-Barré. Oh, see? Hey, if I say Guillain-Barré, you're going to be like, oh, okay. Yeah, I know what you're talking about. Oh my God, I feel so bad. My child is only 7 and I'm going to keep going. Yeah. And that's what happens. This is part of it. Avery, what's up? How are you? I actually was talking about you last live and you weren't here and I'm a little sad that you weren't here. So, I feel guilty if I do something I enjoy instead of studying. That's what nursing school does to you. Alabama, 50 days, until RN. Shout out to you. Tracy from California, scheduled to take my NCLEX in 2 weeks. Shout out to you, Tracy, Miss Tracy. Right. So like I was saying, I've been an educator since 2015. I taught in a surgical tech program for about 3.5 years. Then I got my license at one point, became a trauma nurse instructor. I teach TCCC, pre-hospital trauma. I taught ATLS and BLS and all that other stuff before. So I've been an instructor for a while. So is there Lord of Labeling? What? Is there Lord of Labeling in nursing? I'm questioning. At a Blue Nurse, did you ever consider another career path? You're talking about like not going to become a nurse? Is that what you mean, Alyssa? I promise you, for like almost a decade, that's all I ever wanted to do was be a nurse. And then once I became a nurse, I was just like, you know what? I want to do something different besides working at bedside. And I knew that real quick. And by real quick, I mean day one, first day of me being on the floor. So I remember days I couldn't commit to studying because my head wasn't in it. I'd nap and chill with my kids. And it happens. It really does happen. Lots of labeling. Oh, yeah, there's lots of labeling. You're going to label a lot. What's a specialty you would never do? Labor and delivery. I would never do labor and delivery. I had a really weird experience. Not weird, but I had an experience in labor and delivery where there was a girl in there or a woman and there was 5 dudes and they were trying to figure out who the daddy was. And when I tell you about Maury, look, and mine would definitely be psych because when I did my psych rotation, I never in my entire life thought I was just like, yo, I'm going to like this. And then I'm in here and I'm ready to fight somebody. My goal is labor and delivery. Most women want to go to labor and delivery. What did you say? Goliath said, I would never do psych. I would never do psych either because the whole time I was there, I was ready to fight. Then there was a code green. One dude ripped the damn fire extinguisher off the wall mount. I was in school and I was like, do I punch him? He's behind the nurse's station. Do I knock him out? Will I go to jail? Will I get expelled from school? I'm like, there's a lot of risks that are going to happen here. And I'm like, fuck it. Just knock me over, bro. Just knock me over. OR, ER for me. Hey, some people don't like, hey, I love the operating room. I really, really do. Because, you get one patient at a time. I love mental health. I love mental patients. You be ready to fight? Oh my God. I want to do psych. Y'all make me nervous. Hey, Alyssa, I'm just telling you what my experience was. First 15 minutes was a code green. How is geriatric psych? Is that what you said? I don't know. I've never done geriatric psych. I mean, I would think it would be the same, but geriatric psych is more like if you're like in a long-term care facility and you have somebody who has like dementia or Alzheimer's or anything like that. I've had some dementia patients. The biggest thing is redirecting them. Like that sundown and shit is real. To be honest, you can't escape psych. That is facts. They really are. How would you recommend wanting to get into a specific hospital or specialty? Go straight to it. Go straight to it. And if you can't get straight to it, at least get into a med surg unit to get yourself your experience working with patients, and then go towards your goal of wherever you want to go. I've done ER and corrections nursing. There's another person that does corrections and she loves it. Once I complete my LPN, I will become a director of nursing. Okay, shout out to you. Shout out to you. I'm just, hey, if you're telling me you want to be a director, you better be a good director, because I can tell you right now, there's so many managers and directors that are out here that are fucking ass. They're fucking terrible. And in the end, remember, it's all about the bottom line. It's all about the bottom line. All right. So shout out to all 68 of y'all. This is usually where I lose a bunch of people, but I'll just sit up here and I'll talk that shit. I'll kick the shit with y'all. Whatever questions y'all got, I'm all about answering them. So respect to long-term care nurses. I've had my fill of elderly, right? Do you think it's necessary to become a tech or CNA before becoming a nurse? Do I think it's necessary? No. Do I think it's helpful? Yes. If I can get past RN, I'm going for FNP. How about we say when I get past RN, I will go for MP. How about that? I also got punched in clinicals on Thursday. Oh, Lord of mercy. When a dementia patient says when he says, leave me alone, listen. I can hear you saying, listen. Yes, they are terrible. I want something faster pace, different every day, but still have a relationship with my patient. Something fast paced every day. ICU can do that for you, because shit'll change real quick. I'm going to do my BSN. I don't care how hard it is. That's right. Make it happen, and it shall be so. My first and last patient in a rural Minnesota were mental patients in an 18-bed hospital. Shit. I love the fact that you are so down to earth. And I remember getting in trouble for cursing over, no part of me cares. I mean, when I'm with my patients, best believe, like, I'm not going to sit here and be rude and disrespectful and curse. But like when I'm by myself, bro, look, just because I'm over here expressing myself, telling you how I feel does not display the patient care and the level of nursing that I could give to you. I promise you that. Because trust me, there are worse people out there. And I know that I'm a damn good nurse. So nothing, you cursing, you swearing, shows your, shut the hell up. Go away. I'm going to pass my, yes, you are. Megan says, say it louder. Look, just because I like to say fuck doesn't mean that I'm a bad nurse. Okay. I'm graduating nursing school in 1 year. When do you recommend starting study for the NCLEX? I would recommend studying for the NCLEX anywhere from 2 to 3 months before you graduate. And by me saying that, you at least starting to become familiar with the process, learning questions, getting a review, learning the content, so on and so forth. I cuss a little. Okay. What is a nurse's favorite curse word? Right? What advice would you give someone who failed a class and has to wait a year to come back? Okay, Keen. So here's one thing I'll tell you. How bad do you want it? How bad do you want to become a nurse? You know how many tests I failed in nursing school? A lot of them. You know how many times I failed NCLEX? 3 times. And here I am right here before you to tell you that no one will ever care. But how bad do you want it? How bad do you want to get through a program? How bad do you want to be a nurse? Either be an RN or LPN. Hey man, what degree of education do you have now? Right now, I have a bachelor's degree and I'm working toward my master's. And I have what they call a post-secondary instructor certification, as well as I'm a master instructor in the Navy. So any tips for farm? I would tell you study family name and suffixes. So suffixes. I really think it's this fucking retainer where I can't start to say stuff right. So family name suffixes. So, know where your cardiac. So if I talk about cardiac meds, I need for you to spit them all out to me. And then I need for you to let me know, like, hey, like what are calcium channel blockers? What are, they're dipines and cardiazem or diltiazem and verapamil, right? So I know that the dipines are calcium channel blockers, right? So what do calcium channel blockers do? Now, after you tell me what they do, what are the signs and symptoms that a patient will display if I give them a calcium channel blocker, right? And I need to know what the expected outcome is, and I need to know what the unexpected outcome is. What is their potassium when I give them this medication? That is how I use cardiac meds a lot, because you will see cardiac meds a lot on NCLEX. Because what do I do before I give a cardiac med? Maybe check some vitals, right? Stuff like that. So when to hold meditation. You mean medication? See, and they tell me I can't say shit right or spell shit right. Look at you. I'm just playing. Let me see. Any tips for farm? All my clinicals, I'm on a neural floor. Him and I were talking about the caregiver because they were rude. Yeah. Sometimes, hey, I'm telling you right now, sometimes you got to check people professionally. I've checked people professionally and they don't like it. And I don't care. Say that shit again. How bad you want it? That's what I'm telling you. How bad do you want it? Some people are just like, oh, I don't know if I want it. Okay, if you're telling me you don't know you want it, you don't want it bad enough. If I fail, I'm going back and I'm going back again and I will be a nurse. That's what I'm trying to tell you. Tracy said, thank you. Thank you for your support. I appreciate it. You're welcome. Hold my meditation depends on the type. It does depend on the type of calcium channel blocker. However, this is when I'm talking specifically about NCLEX. It is on a standard. So if I give you any type of calcium channel blocker, it's on a standard, right? Calcium channel blocker, just the overall aspect. Now, if we try to go into depths about, inotropes, chronotropes, and all this other stuff, and which one does which, and, am I checking for potassium? Am I checking for sodium? Am I checking for, we're not going all into that. However, there are those important things. What's going to fucking kill my patient if I don't do this, right? You never push potassium IV, right? Yes, you will never push potassium IV, ever. And if you do, C's get degrees. Yeah, they do. Yeah, I do. Lower heart rates and controls blood pressure. That's mostly what a lot of blood pressure medications do, right? So am I thinking about orthostatic hypotension, right? Am I thinking about, increased heart rate? Depending on what type of cardiac issue that the patient has, what cardiac medication am I going to get? What am I going to give a patient that's an AFib? What medication would I give an AFib versus what I would give somebody who has supraventricular tachycardia, or if somebody's in, they just got shocked because they were in VFib, what medication would I give them after the fact to help with that? Calcium channel blocker for AFib, right? What else would I give? What else would I give a patient if they have AFib? Right? Those are the things that you have to think about. Remember, the NCLEX is increasing your critical thinking and your clinical judgment. So if I give you a question, I need for you to follow that. Amiodarone, that's right. For ventricular arrhythmias, right? You should be a nurse instructor for nursing school. Look, I tried. I've applied at a few. I heard VFib. For VFib, you defib, right? And then, you got to think, what medication would I give somebody who came out of, VFib, right? No, I've had adenosine for you've had AFib and they gave you adenosine. LPN student here. I passed fundamentals. I'm headed to med-surg. That's what I'm talking about. Tay, baby. That's what I'm talking about. So that's how you have to tackle pharmacology, right? And just to let y'all know, I love teaching. That's why I'm going to get my master's in education. Some people, it is not their thing. But also you got to remember is that if you're a nurse, I don't care if you're an LPN or an RN, you have to teach people. You can't be fucking greedy and be and take the information, and then they give you a student and you're just I don't want a student. You can't do that. Yeah, supraventricular tachycardia, A, B, C's, and D's, right? Adenosine, beta block, or atrial issues, right? Beta blockers, calcium digoxin, right? Okay, now how do I study for med-surg? Are you talking about the class? I have a lot wrong with me, apparently. We all got a lot wrong. Trust and believe me when I tell you. I also make up fun ways to remember. So I do. You can make up fun ways for you to remember anything, right? I took that one from where Mark Klimek says to remember calcium channel blockers. He calls it dipping. You're dipping in the calcium channel, kind of dipping your toe into the water, So dipines, except for verapamil and cardiazem, but those are still calcium channel blockers. Or remember those signs and symptoms. What is a really good, and I guarantee you that you'll probably see it. What is a really good adverse effect for somebody who is on an ACE inhibitor? I have said that prereqs knock a lot of students out, but I fought like hell. You want to know what really knocks a lot of students out? It's fundamentals. Fundamentals and health assessment, it will knock. And then med surge is the next heavy hitter. If you can get through med surge, there you go. Who said it? User 89. Give him an ace. Cough in the face. Angioedema, right? There you go. But I'm telling you, hey, Samantha, you got the same last name as me, girl. That's what I'm talking about. We related? Anyways, I'm just playing. But yeah, so those are the things that you got to know when it comes to pharmacology. Know what suffix goes with what family name, like azoles, like AZOLE. Azoles fall under what? Right? Or fungins. Or, sartans, like where do they fall under? Fungi. Look at that. Look at me. I'm a fun guy, right? So those are the things that you got to think about. No, I'm tackling pharma and med surg right now. Look, I'm trying to tell you right now. That's how we do it around here. Hey, if you guys are new here, welcome. My name's Kevin. I go by the Boot Nurse on all social media platforms. By the way, if you missed the questions, I do questions all the time. You can go check them out on YouTube. They get put up there all the time. So make sure you guys go over there and follow. Follow me on Instagram as well. And of course, follow me here on TikTok because I'm here every Monday, Wednesday, Friday at 5:30. Come in here and talk that shit with me. That's what we do. So I appreciate you. Go back to what you were saying, knocking students out. So what we call the nursing killer, fundamentals and health assessments. Those are the first two classes you usually take when you get into a nursing program. That right there is the weed out. That's how we weed them out. Once you get to med surge, that's the second weed out. If you can get through med surge 1, if you can get through fundamentals and health assessment and then med surge 1, you're good to go. I remember my school, like we had, at least in my cohort, there were like 60. I promise you, when we got to med surge, we were almost half. And when we got out of med surge, we were half. We started at like 61 and we were like right around like 33. And then we graduated. Med surge definitely cut my grass in half. You mean cut your ass in half? Oh, your class in half. My bad. I'm sorry. But yeah. What else y'all got for me? What else y'all got? It was 17 people in my class. Now we're down to 9. Look, I'm trying to tell you, leave me alone. Look, you said it, not me. So what else? What else we got going on here? What else we got going on? Got a lot of things that are coming down the pipeline. Like I said, I have a lot of people that ask for tutoring. You guys can go check that out. Or if you know somebody who needs it, just send it to them. No big deal. Send it to them. Also, my 7-day NCLEX course. Like I said, I got 42 videos up there now, y'all. 42 content videos working on the 7-day review currently. And I'm recording the new generation NCLEX 2023 review. So I'm not recording it right now, but camera set up, got my lecture, got my script, got all that stuff. All that stuff is coming down the line. All right. So for $48, you get it for a lifetime. Where is this or where's that? Oh, you can check the link in my bio. It'll say it right there. 7-day NCLEX course in the link tree. So but yeah, like I said, hey, if you're new here, we're talking nursing. Anything nursing related. I want to know who you are, where you're from, where you're at in your nursing journey. If you are new here. Thinking of PACU, hate med surg. I have an OR offer, but I heard you don't use your nursing skills. It all just depends. Honestly, it depends on what hospital that you work at and what your hospital allows for you to do when it comes to like forgetting your nursing skills. And just remember that. Hey, a lot of people will say, hey, I want to go be a nurse practitioner. I can guarantee you right now, when you go and become an NP, you're going to lose your nursing skills because you become a provider at that point. So what does it matter if you go to the OR and you lose your nursing skills? Guess what? It's just like riding a bike. If I took you out of the OR and then I put your ass back in med surg, guess what? You'll figure it out. And usually for NPs, not saying that you don't lose your nursing skills, but a lot of the nursing skills you won't do. And depends on what type of NP that you're going to be as well. Like I have NPs that are friends, like one's cardiac and one's pulmonary. They don't do a lot of those nursing skills because they're not working bedside with them. Not saying that they don't know how to do it. I still draw blood, give shots, etc. As an NP, because like I said, it all just depends on where you work at. I can tell you right now, my NPs don't do it. My NPs, the NPs that I know personally, do not do that. So, like I said, did you like PACU? I'm going into the CV PACU. I'm excited. I love the PACU. I will tell anybody, and I don't care what anybody says. If you can get a chance to go to the PACU, go. A lot of people are just like, oh, you need to have ICU experience. I don't want to hear that. I don't want to hear that, because just like anywhere else, if they train you properly, you will be fine. Now, if they just fucking throw you to the wolves, that's a problem. Connecticut here, shout out to you. I ain't never been up there. I heard it's cold. I usually have somebody that's up in here from Delaware, but I ain't seen him in a while. He's probably stuck. Do exciting the PACU the best. I when I was in the PACU, I loved it. I still can't stick though, but I can do uric. Yeah, you're excited. Okay. Hey, you gotta figure out how to do those IVs. You gotta do those blood draws. Those are normal things. Any cons of PACU? Cons of PACU. Obviously, if you're not ready or prepared for it. Michigan, it's in the 50s and the 40s. I live in Texas and it was 91 today. No. It was hot. Pros and cons. Honestly, I can't really think of any pros and cons at the moment. Honestly, it really just depends on the hospital. Some people that work in PACU, like when you're on call and stuff, like you're there by yourself, like with 2 patients, or you're taking patients on, getting ready for a weekend call or whatever the hell's going on. So it's not cold yet. It's in the 60s. I'm from Texas. That is cold, man. That is cold. I say frío. Okay. Cold. But yeah. So I really, honestly, off the top of my head, I can't really think of like any cons for the PACU, unless somebody else has some cons, and I'll probably jog my memory, But the great thing about it, they come from the operating room, or they come from, from the GI room. They're there for an hour, maybe less, and then you either send them to discharge area or you send them back upstairs to the floor. It was 80 last week. It was. Would you ever become an MP? I thought about, there's so many ways, and there's so many different ways I wanted to go. I wanted to be an MP. I wanted to be an acute care MP, but then I was just like, no, I don't want to do that. For the longest time, I wanted to be a CRNA. And then I was just like, no, I don't want to do that to myself. I want to do something that I'm actually going to enjoy. And I didn't think I would enjoy being a CRNA. The money's great. The money's great for a CRNA, but I just didn't want to, that wasn't my goal and my passion anymore. Then I wanted to do informatics, but I realized I wasn't in there for me either. And then I finally decided on education and stopped fighting my urge to steer away from that, because that it kept pulling me back. And then I was just like, well, how can I educate people without being a nurse educator, even though all nurses are educators, because we educate our patients. So that's why I did this. And that's why I do my coaching. And that's why I created my course, because that is my way of teaching and educating people coming up through the nursing, realm, so to speak. Finding people was difficult because everyone already had IVs. And so, yeah, I know when I get to the ICU, I can. Yeah, you can do all that. Hell, you can even become a PIC nurse. Like, you learn how to drop PIC lines. And being a PIC nurse, all they do is they put in the order. You come, you drop the PIC line, you go to the next patient. And then when they're just like, oh, my God, I got this going on. Hold on, let me tell your nurse. That ain't you no more, My friend is going for informatics now. I have a buddy who's in informatics right now. What is informatics nursing? Every time someone mentions it, I become so lost. So what informatics is essentially is that you are learning how to apply, like new age technology into the healthcare field. That's number one. Number two is you figure out ways to improve the electronic medical records. Right. But, you're using technology to improve healthcare. So I'll give you an example, like, the iPad translators, that's part of nursing informatics, right? Or if you do like if they have home health and they have a patient's at home and they need a refill on their meds, they can literally hit on an app on their iPad or whatever. It'll bring up a telehealth nurse, and then they'll go through their medical record, all that other stuff, and will submit those notes to the doctor. The doctor can make a decision. Like that right there is informatics. That's how informatics rolls. And I believe it's you can become an MP for informatics. I'm not sure. I would have to double check that one though. Smart move. Yep. I'm trying to tell you. Well, as a nursing student, I appreciate you and your lives. Well, ma'am, I appreciate you uniquely being here. I really do appreciate it. Like I said, I love doing these lives. This is like what I look forward to, throughout the day. ADN, if that's my end goal versus going surgical. What do you mean, Matthew? So you want to get your ADN in nursing versus going surgical? By surgical, what do you mean? Like surg tech or like a OR nurse or whatever? Hey, shout out to all 51 of y'all up in here. You guys can still smash the like button. share, follow, all that stuff. Check out my link tree. I got a bunch of stuff in there. Follow me on YouTube. Follow me on Instagram. Hey, we're making moves out here. Did you ever work med surg? No, ma'am, I did not. Or no, sir, I did not. I'm not sure if you are a male or a female or whatever you identify as. I have never worked med surg. Besides when I was in school. Surge tech. I would say that if you want to be a surge tech or be in it says the surgical program would let me finish a year versus ADN. So Matthew, once again, I'm going to tell you just like I tell everybody else. What do you want to do? My opinion is irrelevant. Kevin's opinion, the boot nurse, my opinion is irrelevant. Pack you, love it. Kevin, appreciate the share, but my opinion is irrelevant. The question is, what do you want to do? Both sides have their pros and cons. But the end is like, do you want to be a surgical tech standing in an operating room doing surgical procedures all day? Or do you want to get your ADN in nursing to where you can, be a little bit more versatile? Like, do you want to do that? Did you know that did you know that as a nurse, you could be what is called a CFRN or what is it? Oh my God, a first assist, an FARN. So a first assist registered nurse. Did you know that? Did you know that you could do that? So where you can work as a registered nurse or a scrub nurse or whatever you want to call it. You can do that as well. I feel like for me is when I talk to people when they want to become a surgical tech, I'm just like, okay, do you want to be an FA and do you want to eventually become a licensed surgical assistant? Or do you want to become a nurse and you want to, still be in the operating room, be a scrub nurse, become a FARN, and then you eventually want to be a surgical nurse practitioner? Like, do you want to do that? Like I said, there's so many things that you can do. When I had my surgery on my knee, one of the ladies that was in there, who I used to work with, she worked for an orthopedic group and she's a surgical nurse practitioner. And she used to be an OR nurse. She used to be a surg tech, was an OR nurse, became a first assist as a nurse, then went to NP school, specialized in surgery. So now she works in surgery as an NP. And she loves it. She's great at her job. I'm glad I came across your live. I'm currently doing tele nursing and I want to do something else. You talking about tele? Oh, you're talking about tele nursing like on a tele floor? Girl, I know you're trying to leave. I love that I can finish in 2 semesters. In goal, I want the AD and RN to my name. Then make it happen, sir. Then make it happen. Agree. I'm a surgical tech. Love the job. It pays vary from hospital, however, pros and cons. So I'm a surgical tech still. Like I still have my national certification as a surg tech, right? As an RN, you get paid more, As an RN first assist, you get paid more, but then the jobs are limited, so it all just depends. Yes, telefloor. So there's tons of other jobs that y'all can do out here. They have non-traditional jobs. Like you can work at not hospice, but hospice. You can work outside the hospital. You can go work at a surgery clinic. You can go work in a clinic. You can work at these urgent cares. You can do, if you want to do aesthetics and pump faces full of Botox and lip injections. Obviously, I don't have that problem, but some people want to go and do that. They have IV infusions. You can do nursepreneurship. Like if you want to start your own business like I did and like a bunch of other nurses have, there's tons that you can do. I agree. I also think geographical location has a lot to do with the pay. Oh, 100%. You definitely will get paid less in Texas than if you got paid going to California. 100%. Because the cost of living is high. I had some girl talk about, oh, come check me out as I break down my check for my $211,000 a year salary. But she lives in San Francisco where she makes like $5,000. I think she said like a week or something along the lines of that. But her rent for her apartment is like $6,000. Make it make sense, Sway. I'm going the LPN worth the year or do it. I don't even know how sir, you're gonna have to say that again. You're gonna have to say that again. Shout out to all 39 of y'all in here. Hey, if you're new here, we're talking about nursing stuff. Essentially doing an Ask Me Anything. I did questions earlier. So if you missed the questions, make sure you guys go to YouTube, check that out, those questions, and the whole video will be up there. But I want to know who you are, where you're from, where you're at in your nursing journey. You can still smash the like button. You can still share and you can still follow me because, I'm kind of, cool or whatever. Sometimes I'm going out. I agree, Drew. Yeah, it's wild. Like she was talking about, $211,000. Is it worth going in an LPN program? Once again, that all just depends on you. It depends on you. I am giving you the answers that are the truth. I'm not going to give you the answer that you want to hear. I'm not going to make that decision for you. However, it all just depends on you. Some people are just like, look, I want to go LPN. That's what I want to do. I'm not going to stop you from going LPN, but are there other programs that you can go into? Yeah. What does your money look like financially? Right? So Sharon says no. I will tell you, make the decision based off of what is financially feasible for you. Because you want to know something? LPN's programs aren't going nowhere. RN programs, whether it be an ADN or a BSN, are not going anywhere. You know, it does not matter. The reason why I went the direction that I went straight into a BSN program is because I was trying to become a commissioned officer in the Navy. And the only one that they would take was a BSN nurse. So I had to get into a BSN program. There was no ifs, ands, or buts about it for me personally. Now, for you, depends on what you want to do. Now, if you're telling me that you want to go RN, then go RN. If you want to, take it a little bit, take it a step back a little bit and go the LVN route or LPN route, that's okay too. Some people are like, oh, I wouldn't do that. Well, it's a good fucking thing. It's not your life, isn't it? I'm just saying, a lot of our pockets are not the same, and that's okay too. So this is no shade on anybody. This isn't just me being completely honest. I live in Houston currently. I Surg Tech 10 years. Okay. I started my LVN program or my LVN nursing school journey last August. Shout out to you. True. For me, I felt like it was hard to find a job in my geographical location. Sharon, where do you live at? And you're right. I don't know when you became an LPN, when you went through, I'm sorry. I don't know when that happened for you. I'm guessing, Sharon, you're an LPN. But a lot of people have to realize that before COVID, like they were trying to get rid of RNs. And now it's just like, all these places that were essentially trying to phase LPNs out. It's not going to happen. It's not going to happen. It's not going to happen. Thanks for the interview tips a couple of weeks ago. I got the new grad residency. Shout out to you, Chelsea. That's what I'm talking about. Hey, if I helped you in any kind of way, ma'am, go on. Hey, just send me a DM and tell me how I helped you. That way, I can brag about you. So I appreciate it. I'm so glad that you got that program for yourself. Now you're about to go out there and do some great shit. So I'm super happy for you. Near Detroit, Michigan. I'm an RN for 27 years. Shout out to you. So, what does that say? Oh, okay. Yeah. All right, cool. Got you. So Sharon, we both know that times have changed over that time. It has changed a lot. I just don't know. It's lame to do surgical tech, then do an ADN program. How so? Or just invest the 2 years. How so is it lame to do surgical tech and then do ADN program? Yeah, it's changed. And it says, or just invest the 2 years. Just like you said, invest the 2 years. It's like you want me to make the decision for you. And sir, I won't do that because like I said, everybody's situation is different. And just like you said, it's invest, not waste of time, but invest. Guess what? Go to a 2-year program, invest it, get the same RN license that I got, that Sharon got, that other folks out here got, and then go to school while you're working on your own time. You can do that too. Everybody's building blocks are different. It took me 8 years to become a nurse. From the moment that I said it, it took me 8 years to become a nurse. From getting rejected from schools, failing tests in school, failing my NCLEX 3 times to finally getting my license. I was a corpsman for a while, corpsman for a long time, still a corpsman in the Navy, have been for the past 16 years. You know what I'm saying? Been on 2 deployments, had a lot of delays. It doesn't matter. Invest it in yourself. Invest in what direction that you want to go for yourself. And in the end, that's all that matters. I'm just keeping it real. Inspirational. Agreed. Everyone's path is different. Do what's best for you. Facts. 80 in here. It worked for you. No interest now in my BSN. I created a business. That's what I'm talking about. Right? One thing I'm going to tell you. Once you become an LVN or an RN, that license, when I tell you that opens up like the pearly gates and like, when I tell you can fucking do anything with that, there's so many things that you can do with that. It is unreal. How old were you when you got your RN? I think I was 32, and it's never too late. It's never too late. ADN, yeah, that's what I'm talking about. Sharon started a bit. Sharon, what business? What kind of business do you have? You're a testimony. Look, I'm trying to tell you. Go over to my YouTube channel. Go over to my YouTube channel and look at that video where I said I failed NCLEX. And look at that video where it said I passed NCLEX. And then look at all these other videos where I talk about I have no shame in telling a motherfucker that I failed. None whatsoever. Because what are you going to do to me? And what are you going to say to me? When I told people I failed NCLEX 3 times, I had a seasoned nurse who was 22 years as a nurse tell me to my face, I would never let you work. I can't believe you're a nurse. I would have never let you do patient care if you failed the test 3 times. I'm like, that's cool. I was just like, what the fuck does that have to do with me? Your opinion of me has nothing to do with me. None whatsoever. Because I can tell you from the hundreds of patients that I've taken care of, they were very appreciative of the care that I gave them. And I'm a testimony. I'll tell you right now, because I'm tired of people being out here saying like, oh my God, you failed a test. You can't do that. Oh my God. Hey, shut the fuck up with that negative shit. I'm tired of it. Go away. Get away from me. Bro, that was deep. Like how to shift the mindset, to buckle down and study for this insurance. That's what I'm trying. It's all about mindset. Just like when I talk about money, you have to change your relationship with money. People are talking about I'm broke all the time. Okay, why you broke? You get out a piece of paper and you budget for yourself. You're your own. Hey, let me tell you something right now. This is for all 35 of y'all in here. When it comes to everything in life, everything is your fault. Everything. But then Kevin, you're going to be like, Kevin, but this happened to me and it wasn't my fault. You're right. That happened to you and it wasn't your fault. And my question is, what are you going to do about it? If you guys don't follow Alex Hormozy, that dude is inspirational as hell. And I love that dude. And that's essentially where I got that from, because I literally have it on my board right there. You guys can't see it. It's like over here. It's like double line. And it says everything is my fault. If my business doesn't work, it's my fault. If I failed my NCLEX 3 times, which I did, it was my fault. If I didn't pass a class and whatever, it was my fault. When I got my divorce, partially my fault. Not all my fault because it takes 2. But everything's your fucking fault. Everything. So what are you going to do about it? So you better, and so I'm gonna tell you just like I used to tell like my soldiers, my airmen, and my Marines and my sailors, hey, figure it the fuck out. But I say figure it out, but they have all the information and they have the guidance. What's your sign? I love your ambition. What do you think my sign is? What do you think my sign is? Put it this way, my birthday's coming up. So what do you think my sign is? A lot of people tell me I should do motivational speaking, and I've been really, really considering that. Because once you find who you really are, it don't matter what a motherfucker says. I didn't even believe that. I used to be a shy guy. I used to get made fun of all the time. I promise you. And then next thing you know, I don't know what happened. It's just like I got this newfound confidence about myself, and you could look at me and just tell me, hey, you're uglier than sin. And I'm gonna be like, you're probably right. But hey, however you feel ain't a Kevin problem. That's a you problem. So I'm gonna need for you to figure out what the fuck you are talking about, because that don't got nothing to do with me. So I'm just saying, I'm just keeping it real. I'm gonna hang out for another 3 minutes, y'all. I've been really good about keeping my time to about 7:30, from 5:30 to 7:30, giving y'all some goodness. All right. What else y'all got? I'm a Capricorn. Oh, you're a Capricorn? Because, ma'am, baby, no. Coming up when though, you could be a Scorpio. I could be a Scorpio. I'm not a Sagittarius. I am a Scorpio. I'm a Scorpio. I know people are just like, oh my God, Scorpios, oh my God, whatever. Look, don't be over here. I'm not a big astronomy guy like that, but it's just like, it comes with people. It doesn't necessarily mean their sign. So, hey, but Scorpio gang, y'all know how we do out here. Shout out to you, Eliza. You know what I'm saying? No, my dad's a Scorpio. I love it. That's what I'm saying. Shout out to my Scorpios out there. Scorpio season is right around the corner, so you already know what I'm about to do. I'm not going to do nothing. I'm going to sit home. I'm going to be bored. I'm going to be boring. That's what I do. Because your boy got ambitions. He out here trying to, be the best that he could be and bring others up with him. That's what I do. So what else y'all got? I got 2 minutes. Shout out to all 32 of y'all rocking with me. My birthday's on the 31st. My birthday is the 31st and it's on the 30th. Save the world. You know what? I'm not trying to necessarily save the world, just the people that want to be saved. I guess that sound real biblical. I ain't trying to be biblical, I promise. My birthday's on the 28th, so you know what I'm saying. And I'm going to a Longhorns game, so hopefully let's watch them beat BYU, see how that goes. So, but say that. I'm trying to tell you, I'm trying to be out here trying to be great. I'm out here chasing greatness, y'all. That's what I'm about, chasing greatness. All right. I appreciate everybody rocking with me. I appreciate it. We'll be back on Monday, same time, doing our thing. I just want to let y'all know, hey, Scorpio 27, that's what I'm talking about. We'll be back on Monday doing, same time doing this. Are the lives during, who said that? Hold on. It says, are your lives during, all these daily? I don't even know what you said. I'm assuming that you're saying, do I do my lives daily? And I do them Monday, Wednesday, Friday at 5:30. You can check that link out check that in the bio. I put it out in the bio, so in case anybody wanted to know. But hey, remember, everything's your fault, so you need to figure out how to fix it, right? And next thing, just be kind to yourself. Like there's only one you. I'm all about this mental health thing. I'm all about it. Get the help that you need for yourself, but be kind to yourself because there's only one you. And if you can't accomplish your goals and your dream for yourself, you are no fucking good to nobody else. I don't care if it's your wife. I don't care if it's your husband. I don't care if it's some damn kids, because I got some. If I can't do what I need to do for me while still taking care of them to provide better for them, if I can't do what I can do for me, then I'm no fucking good to nobody else. It doesn't matter who you are. All right. So like I said, be kind to yourself. Love yourself. You only got one you. Trust and believe me when I tell you that you only got one you. So yeah. Hopefully, I hope everybody has a great weekend. I hope everybody has a safe weekend. And if anybody ever has any questions about anything, y'all know where to find me. Just shoot me a message. Make sure you guys go over there and check out the Linktree, thebootnurse.com. If you need coaching or know anybody that needs coaching, I do a 15-minute consultation to see if coaching is even for them. And the 7-day NCLEX course is in its pre-launch phase. It's $48 and you get it for a lifetime. So go over there and check that out. Like I said, be kind to yourself, be great to yourself, and I will see everybody on Monday. Bye.